We may finish it on Tuesday. I don't know yet. Okay. Advanced directives is legal document or are legal documents that explain the measures somebody wants to be done in case that they are not to be done in regarding to life support. Like, do they want life support? Do you not want life support? What all would that entail? So there's 3 types basically. Okay, you have a living will, which is basically where you write out what you would and would not want to happen. Okay, a durable power of attorney is a document that specifies a person to be like in charge of all of your decision making, okay, all of the decision making. And then a healthcare proxy, that is actually a person that you designate to make medical decisions. Doesn't have to be the same as a durable power of attorney necessarily. Okay, so a living will is a legal document with medical treatment instructions that are written for healthcare providers. So typically you see this, you might say, no, I don't want to be put on a ventilator. Yes, I would want to be put on a ventilator. Or yes, no, you wouldn't want a ventilator, but yes, you would want tube feedings if you needed it. Or you can specify exactly what treatment you do and don't want. Now, this is only going to come into place if you are terminal and you can't make decisions for yourself. Okay, now, if I come in and, if you're completely with it and you can speak, they're not going to refer to your living will.
They're going to ask you.
Yes, exactly. And this is only in the case that, one, you're terminal, and I mean imminently terminal, and you can't speak for yourself. You can't let them know what you want. Okay, durable power of attorney, a document that gives a specified person the permission to make legal decisions on behalf of the patient in the event that they can't make those decisions. So this is any legal decisions. This can serve as a medical for a medical purpose as well. Okay, so you can designate a person that you'd want to make healthcare decisions on there too. And these documents are really, you can just go to like the state of Texas website and print these out. And they're really easy to find. Actually, you can go to any hospital website and there's usually a link to them. You just print them out and sign them. Okay, you can limit the rights and responsibilities of the person designated to make the decisions. You can actually limit what they can and can't say. Okay, healthcare proxy is specifically a healthcare power of attorney, and the patient can specify treatment and types of care as well as designate a person. But you typically consider the person they're kind of called your healthcare proxy. Okay, client autonomy. You've heard me say that word a couple of times. Auto means self. Like an autopsy literally means like to view oneself, which doesn't really make sense because you're dead, but I don't know why that helps me remember it still. But autonomy, auto is self. Your autonomy is just your right over your own body to make your own decisions. Okay, so my autonomy is that I can say no to this medicine if I want to, or I can do what I want within my boundaries. Okay, so in client autonomy, as a part of that, every hospital, every healthcare facility, all places like that have what's known as a patient's Bill of Rights. Now the ones I have listed on here are really just kind of generic. Most patient Bill of Rights will have these, but if you go to any, like if you go to the Paris Regional website, and you're going to find their patient Bill of Rights, and all of them are going to be listed. Same thing with Hunt County. It goes on from there. So, but you're going to see most of these generally. These are, like I said, kind of generic, but you'll see them more specific at each, wherever facility you're talking about. Okay, so number 1, receive considerate and respectful care. Everybody has the right to go to the hospital and be respected and, be considered. Okay, for them to be considerate of you and your thoughts and what's going on with you. Okay, everybody, all patients have a right to receive complete and current information related to your diagnosis, treatment, and prognosis. Do you know what prognosis is? It's like your outlook. Okay, like if you're expected to live 6 months, or if you're expected to have this disease forever, whatever, that's your prognosis.
So if you ask, they legally have to tell you?
Yeah, if they know, they may not know, but they would have to say. But yes, you have a right to know that. You just have a right to know about what's going on with you. They have a legal obligation to tell you what disease you have and to tell you, how to make that better to the best of their ability anyway. Okay, you have the right to know the identity of healthcare personnel. That's why anytime you're working in healthcare, you always wear a name tag. Everybody's always going to have a name tag because everybody has the right to know who they're working with. No immediate and long-term costs. And you have the right to ask that and know that information. All patients have the right to obtain information about their health care, review medical records, and have anything explained that needs to be explained. You always can get your medical records. Now, it may not be an easy process to go through to obtain those, but you do have access to them. I mean, it's your information. You know, you can always ask for it. You may have to pay like a paper fee or something like that. A lot of places do, but you have the right to continuity of care. What word do you see in there? Continue. Okay, continuity of care just means that if you get moved around to different areas, okay, then your care is continued. It's not like you have to, you know, like let's say I go from the hospital to the operating room, okay, like the hospital floor to the operating room. The operating room shouldn't have to start a new IV. They shouldn't have to make me list out 8,000 medications, even though sometimes they do that anyway. Okay, that the nurse in the operating room needs to have talked to the nurse up on the floor and know if I have any allergies or if there's anything else going on. That's continuity of care. Does that make sense? They're communicating, okay, and they need to do that if they're going to take care of you and take care of you well. Be informed of business relationships of provider. So if a hospital is affiliated with someone, they need to know that. There's someone who's, you know, and I don't, receive information necessary to give informed consent. So what are some things, what's some information that's necessary to have informed consent?
Consent paper?
Yes, what we talked about it the other day though. What are some specific things that they have to know before they can sign that?
What they're signing, where yes, like they have to be able to understand.
They have to be able to understand.
Like what's going to happen.
Yeah, what's going to happen. So the method of treatment.
The tests and procedures they're going to do.
Mm-hmm. Risks that come along with that. Alternative treatments, like if there's any other way that can be done. And then the risks of the alternative treatments need to be discussed too. What happens if they do nothing? Okay, they need to know that too. So there's several things involved in that, and people need to be aware. They have to be able to understand. Like you said, they can't just sign it and not understand. Okay, patients have the right to obtain advance directives, to be offered that and to sign them if that's what they want to do, as long as they are of sound mind. Now, if I'm already out of my mind and can't make decisions, I'm not going to be able to, you know, make a living will. Okay, that's going to be out of what I can do. Patients have the right to refuse treatment to the extent permitted by law. And what that means is, yes, they have the right to refuse treatment, but if the court orders some kind of treatment, then, you know, that right is gone. Like if the court orders that they have to be committed to a psychiatric facility, okay, they can't get out of that. And that's something that's been ordered. They kind of lost their right to get out, to refuse treatment for that. But pretty much everything else, you can always refuse treatment. If there's something you don't agree with, something you're nervous about, something you're like, I don't want to do that, you have the right to refuse it. Receive consideration related to privacy. So everybody has a right to their privacy. Everybody has a right to be covered up. That means like literal privacy, like covered up in your bed in the hospital, and it means privacy, you know, your information. Assured confidentiality, same idea. Obtain reasonable responses to requests for services. Hey, everything that you ask should be done at least within reason. Okay. I'll just stop right there. I may just finish this.